All right. Hello, everyone, and welcome to the Babies in Common Show. I'm Jeanette.
And I'm Melissa. Welcome, listeners. As a reminder, any information shared during the show should not be taken as medical advice. Please consult your own care provider for questions about you or your baby's health and visit babiesincommon.com/disclaimer for more information.
Awesome. So today is Wednesday, October 14th, a beautiful fall, and we're going to be talking today we're going to answer questions from the Babies in Common community about feeding babies, breast, bottle, and solid foods. And we put the word out that we were looking for questions for this episode in the Facebook groups that we have, and we got answers from contributors in those groups.
And I am super excited for this episode because this is the first episode where I get to interview you, Jeanette, because you are an IBCLC. I feel like that should have like a trumpeting sound after it, but and so knowledgeable. I know that you take very seriously your continuing education, and the amount of conferences and workshops you attend is awesome. So I'm always hitting you up for information, and I'm excited to be able to ask these questions on behalf of the Babies in Common community to learn more about, breast, bottle, and solid foods. So let's dispel some myths. That's actually one of my favorite things about being a childbirth educator is I'm like, hit me with those myths. Anything that I say that's different than somebody you read or somebody told you, I want to hear about it. So let's start off with one question from a listener. And she says, what important numbers should I have after birth? Meaning, what types of, people or practitioners should you ahead of time get the number for, get the contact information for before you have that baby? So what do you think, Jeanette?
I was just, something as you were asking that question reminded me that actually when I was pregnant with my first baby, some people that I worked with said, oh, there's an IBCLC that you need to call as soon as your baby's born. If you need any help, she's the girl. And I think there were like 3 people in my office that had said this. So I knew, right? And I didn't end up calling her. I called somebody else. I think I had a postpartum visiting nurse, and she was also an IBCLC. So we hired her to come back and help because I was having a lot of breastfeeding issues. And she didn't help as much as I needed. And so after suffering for a couple more months with a lot of pain.
Oh, wow. Months.
2 months. Yeah, 2 months. I finally called the person that I was told to call originally, and she solved my problem within a couple days.
Oh my gosh.
Yeah, I know. I was like, oh, lesson learned. So talk to people on the internet, talk to people in your life, talk to whoever you can, and get a bunch of names of international board certified lactation consultants who are in private practice who can either come to your home, depending COVID depended, either come to your home or do a virtual visit. There's like 1 or 2 of us in Massachusetts that have offices, but also some, I do home visits as well. But I think knowing who are the people you can call, and you don't have to just have one number, because what if they're not available? What if they got sick I've had times where I was out of work for 11 days because I had a really bad sinus infection or whatever it was. So it's good to have other people's names so that you know who to call. And sometimes a prenatal consultation is also warranted. If you've got high-risk factors like polycystic ovary syndrome, you went through fertility for hormonal issues, if you have gestational diabetes or actual diabetes, if you know you have thyroid issues, sometimes that can come into play. If your breasts are a little bit different or grew a little bit differently, if you have any worries in particular, of course, taking a prenatal breastfeeding class with me or someone else is really, really important. But even after that, having a consultation is sometimes really warranted. And then postpartum doulas, like those are underrated people who can really help you. Underrated's the wrong word. They're really highly rated, but they're not talked about enough.
Exactly.
Underutilized is the word, right? They're not talked about enough. And postpartum doulas are amazingly helpful. They shouldn't be replacing an international board certified lactation consultant unless they can fix your problem. And if they can fix your problem, awesome. Some of them are breastfeeding counselors who have enough of training and experience that with a little help from them to help with latch or bottle feeding or just supporting you to get sleep and eat well, if that makes everything go smoothly for you, then you don't need the extra help from other clinicians. But sometimes even just friends, right? Like who are the mom friends or even the dad friends or the family friends or the grandparents that have experiences raising kids the way that you think you want to?
Yes.
And I say you think you want to because that's going to change over time and it's different. But sometimes, I have clients and friends who are like, "Oh, I gave your name out, but I think when I went over to her house, I helped fix her latch, and she just needed a couple help." And I was like, "Great, that's awesome. If it's that easy to fix, then you don't need extra help." And I guess the last thing I'm going to put back to you is, as a breastfeeding counselor, can you explain what the difference is between a breastfeeding counselor or a certified lactation counselor versus an international board certified lactation consultant in private practice, I'll say,
Sure.
because those in the hospital are wonderful and they know a lot of things about a lot of things, but sometimes you need people who really focus on life with baby after you get home,
I agree
not,
with that.
you know,
So I am a nurse. I've been an OBGYN nurse for 14 years. And it's important that you understand that as a nurse, myself, like most labor and delivery slash maternity nurses, got very little proper breastfeeding education unless they are working for a baby friendly hospital that does require a
which
pretty
is a
good amount
special
of,
designation. It's an
yeah, special
international designation
designation
called baby friendly.
where everybody, not just maternity nurses, but everybody in the hospital has to have some education
Even
about
the
breastfeeding.
janitors.
Yeah, even the
Hmm.
janitors,
Yep.
even the PCAs in the ER that
Hmm.
have to know where you get a breast pump if a breastfeeding
Yep.
mom comes in with COVID-19, right? Like,
It's really cool.
so it's super cool. But so I got very little. I mean, I got my orienter showing me how to shove a baby on a boob. Like that's
Mhm.
basically it. And it was whatever else I read in textbooks. So most even maternity nurses do not have proper evidence-based, up-to-date breastfeeding information and information about human lactation and how that actually works.
Which is
Um,
partially why when they come to see you in your postpartum room, they're all going to give you different advice.
yes,
And
yes,
sometimes they might all be right, but they're just kind of throwing ideas out for what they're seeing in the moment they're in there. And
right.
sometimes the stuff they're telling you is totally not right. So it's
Exactly.
hard to really know.
It's like those, those sticky hands you can get in the little, 25-cent coin machines at the
Yeah.
grocery
You
store.
just
It's like they're
throw it,
just
it sticks to
throwing
the
these like
wall.
sticky bombs to like, let's see what sticks. So as a maternity nurse who cared very deeply about giving proper information, even before I became a breastfeeding mom, I, went on to take courses on breastfeeding. And then after I became a mom, I actually took a CLC course, certified lactation counselor course. But again, this CLC or LC or whatever, if it's not an IBCLC, it's really just whatever that organization has decided to name the lactation helper. It's not something that has a specific test or registration or state license or
And it's
anything like that.
typically 4 to 5 days long.
Exactly. I took a CLC course, certified lactation counselor course that was 5 days. It was a ton of great information. It was 8-hour days, five days a week, and I learned all about the foundations of the physiology of human lactation and how to identify a good latch. But pretty much anything was when it came to troubleshooting problems, they would always say like refer to somebody with more experience, basically was, so while WIC counselors and CLCs and your mom friend that breastfed definitely have a place in supporting you during your breastfeeding or chest feeding journey, if that's what you're choosing to do, they do not have the 900 plus hours of lactation education and the hands-on experience that an IBCLC who had to pass an international exam to get that designation has. The other thing I'd like to point out is that if you have an IBCLC that gave you advice in the hospital and they're a hospital-based IBCLC, they only work with babies in usually the first 5 days of life. Or
There's a
maybe if
few that
they're
work in private practice a little bit,
right,
but that's not that
maybe,
common.
but not
Right.
very
Yeah.
common. Sometimes they work in the NICU and they're
Hmm.
specializing in premature babies.
Yeah.
But generally speaking, it wasn't really until I became a home birth visiting nurse that I got to see how different some of the issues can be for a parent whose milk supply is now in, because many times you're discharged from the hospital before your milk supply is even in, a baby that has grown a little bit more, and has, different abilities and whatnot, how that can affect the lactation partnership, that's different than that first few days in the hospital before your milk supply has transitioned to mature milk and the baby's still trying to come out of their, post-birth, coma sleep of 24 hours. And, it's just different. So if your expertise is pretty exclusively in the first, 0 to 5 days of life, and you're having problems with a 1-month-old or a 2-month-old or even a 2-week-old, I would highly recommend hiring a private practice IBCLC, someone that sees babies that are not just in those first few days of life and really know how to troubleshoot, those types of issues. Because it's not to say that the people in the hospital aren't knowledgeable or smart or helpful. It's just, their expertise is different. So having a number of that internationally board certified lactation consultant, and of course, Jeanette here at Babies in Common is one, but there's lots of zipmilk.org is another great resource for breastfeeding support in Massachusetts. I know. Is that nationwide?
So the federal government purchased that and they're working on making it go national, but it does work for many states now. I forget how many, but a lot, like
That's
maybe 10 or something.
So maybe if you're not in Massachusetts, you could try
you might be able to use Zip Milk as well. And it also lists breastfeeding support groups.
Definitely.
Zip
Milk, like zip code.
Yep.
So
you
Zip
put your
Milk.
zip code in and you can read about what each person offers you. So yeah, that's helpful.
Excellent.
So yeah,
All right. Number 2, Jeanette, how do you prepare to breastfeed or chest feed if you have inverted nipples? This is something that, if you didn't have somebody look at your chest when you were pregnant, and that sometimes happens, in prenatal care, it's just not something that's looked at. You lift your shirt up to give the baby that first latch in the delivery room, and the nurse is like, oh, those nipples are in. Has anybody talked to you about this? And the patient's like, sometimes like, no, I didn't even know this was a variation of normal. So what should they do?
Yeah. And I mean, people are surprised because it's really common in obstetrics to not have someone look at your breast in that way. They might do a breast exam for you at your annual exam, but they're not looking at your nipples and going, oh, you might want to think about that.
Are you thinking about lactating someday?
Yeah.
They're not really thinking about that.
Right. That being said, a baby with normal anatomy and a really good suckle should be able to give a hickey on anything. So
can we get that on a bumper sticker?
Like I always say, like your forearm, your cheek, like they should be able, like sucking on part of your breast that's not anywhere near the areola or nipple.
Yeah.
Right. That
I've
happens.
gotten a couple hickeys before.
Hickey. And like, other grandparents and partners, like sometimes they'll giggle because their baby is like trying to suck on their chin or their cheek, and they can hold on pretty well when they have really good anatomy. That being said, sometimes when you just gave birth, the baby's a little like, whoa, what just happened to me? And sometimes the process of birth or how they were in utero, that initial latching could be affected by the birth process, or that they had like their fist pressed into their chin for the last 3 months. And so maybe initially in the first few days or even a couple weeks, they need extra help to get their body to work correctly, even though their anatomy might be fine. So inverted nipples might be a challenge in that situation, right?
Absolutely.
So if you can create a mound with your breast, so squeezing your breast in such a way that your fingers are out of the way, but you created a breast like some sort of big sandwich. I used to say hamburger, but not everybody eats meat, right? I
know.
I try not to say burger.
I usually say burger too now. I'm going to be more mindful of that.
Like a really big sandwich. Yeah. I have a picture.
Really big vegan sandwich.
Right? I have a
gluten-free vegan sandwich.
I have a picture in my prenatal breastfeeding class in the slides of a really beautiful sandwich, and you can't tell whether it's like chicken that's fried or like some sort of like beef
tofu or
something, but it looks really good. And I've had multiple people in class be like, wait, whoa, that looks really good.
You're like, then open wide like your baby.
Open wide like you're going to eat a sandwich. So you want to create a big mound, and that ideally, sometimes you have to keep your hands on that mound. So many people who are nursing, especially when it's their first time nursing or first baby they're nursing, they get the baby latched on, they immediately let go of the breast and move their arms.
Yes.
And I'm always just like, freeze. If that baby latches, don't move.
Right.
Or like
wait till they really suck that nipple in.
Like, wait till they're going, wait till they're suckling, and you're like, okay, this feels good, doesn't hurt at all, because it shouldn't hurt. That's a myth. It should not hurt. I mean, the myth is that it should hurt. It should not hurt to nurse.
Yes,
So
yes.
wait, and then maybe a minute or two into it, you slowly, finger by finger, start to slowly move if you can. And sometimes as
Yes.
you're both learning, you might have to hold your breast for weeks, just
That is true.
because of the issues that you've got going on. So I think the other thing you can do prenatally is if you're pretty sure that your nipples go inward, so they're inverted or they're very very flat, can you play with your nipples and like wiggle your fingers around them like a radio dial kind of thing?
Do all millennials and Gen Zers know what a radio dial is, though?
um,
So imagine a knob on, I don't know, a receiver or something, maybe your car stereo.
right. Yes.
Can you twiddle the nips to get them? I always ask people if I notice that their nipples are flat or inverted. As a nurse, I say, when you get cold, do your nipples poke out? And if
Mm-hmm.
they say yes, I'm like, oh, awesome. Let's kind of toy with them a little bit.
Mm-hmm.
Get
Right.
them to poke
Right.
out a little bit.
Right. Right. Yes. So some sort of twiddling with them or playing with them. And sometimes just stimulating them, and could a partner suckle on them if you are interested in that? Like what happens to them? Do you ever, like you said, like when you get cold, do they ever poke out a little bit? But figuring out what kind of capacity do they have to extend a little bit. And if they don't, there are contraptions that you can get that you could wear for part of the time, usually at home. They're not something that you would probably wear during the day if you're going to work.
Are you talking about like breast shells?
So there's the shells that are sort of like almost like a UFO, and they've got a little hole for your nipple, and you put
They're
them in
like
your bra.
plastic.
You don't want to
Sure.
wear those for a long time. They can irritate your skin. But even better are these little suction cup things. And there's a couple different brands that are out there. People can message me if they're curious. I don't necessarily
Yeah,
want to be like
send a
showing all the
message
brands,
to
but
what is it? info@babysincommon.com if
yes,
you want to know.
yes.
They look like a tiny little suction cup one, like with
Hmm.
a little bulb. You press
Sometimes
the
they don't
bulb.
even have a bulb now.
Oh, really?
Yeah,
Interesting.
yeah.
I heard, tell me if I'm wrong,
Mm.
busted this myth, that those little suction cup nipple
Mm-hmm.
stimulators were originally invented for the porn industry.
Mm-hmm.
I
Mm-hmm.
am
That's what I've
right.
heard as well. Yep. Yep. That's what I've heard as well. So bound chicka wow wow.
All right.
Yep.
So,
So yeah, and then the one last thing with inverted nipples is that sometimes using a nipple shield after the baby's born is a way to help the baby nurse. And there's just too many people who are leaving a hospital in particular who were given nipple shields. And I have friends who work in hospitals or used to work in hospitals, and they themselves are like, oh my gosh, we had to give those out like candy because we needed to help the baby latch and we didn't have the time to spend to really figure out what was going on. Right?
right.
And when you
Yes.
just give birth, you're not necessarily, you may miss some of the education they're giving you where they might have told you, get help after you get home. You
Right.
shouldn't be using this a long time. So I've seen people that are like weeks later going, oh, nursing's going great, blah, 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 blah. Latch is really great. I mean, I use a nipple shield, but everything's great. And I was like, you use a nipple shield. It's a lovely tool, but that is not meant to be used long term. And anybody that uses it for more than a few days is like annoyed by the thing.
Yes, because it is invisible. And I had to use a nipple shield per your advice because I actually had a lactation consult with you for my third baby
Mm.
because we used it in my instance because I was fire hosing her during my letdown with my poor little teeny baby. And yeah, it is invisible. It's like the second you drop it, it disappears. And
There's
then the
rumors
baby's
they're
like,
gonna they're making them in glow in the dark
oh
now,
my
but I
God, that
haven't
would be
heard.
wonderful. So
Yeah.
you actually did a really good video on, I want to say it was about a year ago. Maybe you should repost it,
Mm.
where you talked about how if you have a nipple shield, that is a ticket to remind you to call an IBCLC
Yes.
after you get home. Like a nipple shield should never be something that, you are using without the guidance of an internationally board certified lactation consultant. So yes, sometimes in the hospital we give them because we just need to get that baby to latch. We need to stimulate, right?
Mm-hmm.
And we can even hand express some colostrum into the baby's
Mm-hmm.
mouth, know that they're getting what they need, but we just want that baby to try to learn, like
Yep.
to do some suck training, right? But sometimes they're just given as a Band-Aid, right?
Mm-hmm.
Like, oh, it hurts you. I'm not going to take the time to figure out how this latch can be better. I'm just going to give you this nipple shield to put a Band-Aid on that.
And in their
That's not
defense, though, there are some places where lactation consultants have so many people they're required to see in one day
absolutely.
that
Yes.
they're in
No,
a
I'm
rush and they don't have time. And that
totally
sucks. Or like the baby's already asleep when they come in and they're like, oh, I'll try to come back later. And then they don't have time to come back. So,
right. So I'm not judging
yeah,
anybody for
right.
this. I've been under those pressures. I've had an assignment that is bananas, right? But if you have a nipple shield, please go to, Jeanette, go to babysincommon.com/resources, go to zipmilk.org and
Mhm.
find an
And we
IBCLC.
can do a virtual consult for that for people who are far
Absolutely.
away. I can be very effective over a camera.
I've actually heard that. I've as a visiting nurse with Embrace and Whiffrey, which is a home birth practice in Central Mass, you've done some consults for some of our
Mm,
patients, and so I go to see them like at the
mm-hmm,
2 week or 3 week visit, and they're like, "Wow, I was skeptical that this Zoom,
mm-hmm,
consult was going to be good, but yeah, Jeanette really, helped us out a tremendous amount and knew how to have us angle the camera and
mm-hmm,
whatnot." So for those lactation consultants that have, embraced the virtual consult
mm-hmm,
in these extreme circumstances,
mm,
don't be turned off by that. I mean,
yeah,
help, you need help. Just because it's a pandemic doesn't mean that you
right,
should go without help. So
right,
I think be proactive is the
yeah,
bottom line to that question, right? Like,
mm-hmm,
don't give up all hope because your nipples are averted,
right,
but
right.
be proactive
Or
about.
even if you're using a nipple shield for some other reason, the one other thing I would say is, you said like it's your ticket to see an IBCLC, and there are some families will tell me, well, we did see an IBCLC. We saw one in the hospital.
Right.
I'm like, I know that's not the one. That's lovely, but that is not what we're talking about. We're talking about
Right.
if you're still using it when you get home, you need to have an appointment set up. And there's so many people. I would say 70% of the people that I see pretty much say, I wish I would have called you sooner.
Absolutely.
And sometimes I'm like, I wish I had met you like the week after you had this baby, or maybe on day 5, because oh my gosh, I think I could have saved you so much suffering. I'm not saying I'm a miracle worker and that I would have fixed everything, but
Mhm.
I know for sure I would have fixed some of the things that you have going on and made life easier. So
Absolutely.
yeah, definitely.
All right.
Cool.
Number 3, one of our listeners, that's actually a pretty common question on Breast
Hmm.
Milk and
I got
Conversation
one
Facebook
today.
group.
Hmm.
How do I make safe choices about medications when I am breastfeeding? How do
Yes.
I know what's safe for lactation? So what do you say, Jeanette?
So the way I usually put it is like 99.999% of the medicines that you might be given are fine for breastfeeding, but not all of them are. And
Hmm.
sometimes there's caveats, and sometimes it depends on the age of the baby, it depends on the dosing, it depends on whether you're breastfeeding 100% or giving your baby 100% of your milk in some way. But most of the time, a prescription medication is going to be fine for breastfeeding. And there's more, this is not a fact, I've not counted them, but I feel like my sense of it is that there are more medications that are over the counter that you shouldn't be taking when you're nursing than there are prescription medications.
Oh, really? Now tell me
Yeah,
why. Is it because they're dangerous for the baby or dangerous for your milk supply? Because there's really 2 categories of
right,
medicines you shouldn't be taking.
right. Yeah, I think the ones over the counter are more often than not dangerous for your milk supply.
Hmm.
Yeah.
Like a
And
lot of allergy medications. Think about anything that dries
mm,
up your mucus,
yes,
right?
yes,
Anything that,
yes.
that that like cold medications, allergy medications.
Sudafed is like one pill can crash someone's milk
In
supply.
fact, I used Sudafed twice to crash my
Mhm.
milk supply when I weaned my kids. So I was like, I want no more milk.
Yeah.
You're 3, you
My
get
little red
eggnog,
pill.
and I'm gonna take a Sudafed and end this game right now.
Yeah,
No.
yeah. Yeah, so I think there's that. I mean, there's things that make you drowsy that can make your baby drowsy. Sure.
Sure.
So as far as like medicines, unfortunately, and I put this out there that again, as a nurse, you've said this, but like doctors, nurses, midwives do not tend to get much training about breastfeeding, right?
Correct. Please put it on a billboard.
Especially if they're not working in the world of babies, right?
Even if they are. I
But I will
remember.
say more family practice and pediatricians are better about these answers about medicines than non-baby doctors,
I would agree with that.
right?
Hmm.
So, but people forget when they're an ER doctor,
Yep.
or I may say that differently. People are perceived by me to have forgotten or not thought about when and I don't know what they're really thinking, but like if you're an ER doc or a radiologist or an anesthesiologist, I'm not going to say anesthesiologist because usually they know the answer, but But there's lots of doctors out there and nurses who will say, oh, you can't breastfeed on that. You're going to have to pump it up. Dentists are notorious for this,
Yes.
right? And the reason is because they're afraid it's going to be dangerous for the baby. But they are not the care provider for the baby, and they have no purview, oversight, right to be talking about anything that's going to affect the baby. They should be saying to the parent, check this with your baby's doctor.
Yeah.
Typically, or your lactation consultant, because I'm happy to answer that question randomly. For random people can text me and be like, what about this drug? And I'll be like, here's the information. Like, I am passionate about, like, please don't pump and dump. There's like, I try to get people to repeat after me in my breastfeeding prenatal class. Never throw milk away.
Yeah.
Like, there's always something you can do with it. And usually it's feed your baby with it.
Absolutely.
But yeah, it's really crazy.
Well, I'd actually even go one step further because I'm a provocative person.
Aren't we both? Aren't we both? Yeah.
And you said, maybe the dentist or the ER doctor or the radiologist says, don't pump and dump because you should pump and dump because this might be unsafe for the baby. It's not even that. In my experience working in healthcare, it's pump and dump because I don't want the liability. It's really not about worry about the baby. It's this idea that pregnant people or people that are lactating are a liability. Think about the things that you buy at the store, things that are marketed towards pregnant and lactating people, like prenatal vitamins sometimes say on them. Check with your doctor if you're pregnant or lactating. It's like, are you effing kidding me? This is a prenatal vitamin. If it's a prenatal vitamin, I should not have to consult my provider, right? If it is a pregnancy that I shouldn't have to consult my provider about it. So I think that it's a lot of just I don't know about that woman stuff, so just pump and dump, and this happened to me when I worked in an office setting. There was this one nurse that kept telling people whenever someone would call with symptoms of mastitis and qualified for antibiotics, meaning it was serious enough to require antibiotics, she would say, take this medication 4 times a day for 10 days. And if the patient would often always say, is this safe for breastfeeding? And she would just knee jerk say, because I would read her notes afterwards if people called back. She'd say, well, just to be safe, just pump and dump. Okay. And I finally pulled her aside and I was like, whoa, listen, I'm not saying that you don't know what you're talking about because you're not a mom, but I need to explain something to you that pumping and dumping to somebody who is breastfeeding, especially a small baby, is extremely it's an upheaval to their entire life, right? This, she now has to pump and dump that milk and give the baby something else. And if she doesn't have pumped milk to give it, then it's going to be formula. And not only are you wrong that this medication is not safe to nurse with if you're taking, but let's say it was very important that you not nurse with this medication. Let's say it was the one antiviral or chemotherapy drug that you absolutely cannot nurse with, right? Or not feed the baby this milk. You have to understand that this could end their breastfeeding relationship. Right. They could be like, I haven't figured out pumping yet, or I'm already overwhelmed by parenthood, or
the pump
my baby
hurts.
won't, if the pump hurts or whatever, I'm not getting, and so you gotta stop saying that. I was really adamant about, I did a whole education campaign that, everybody in the department, because I'm like, this is a big deal. Telling people to pump and dump is not this simple thing. Right. So if you have been told to pump and dump, don't take their word for it. Do your research. Now, you said you could text you, and of course there's breast milk conversation groups. Are there any resources on the internet or in books that you would recommend?
So there's an app called Mommy Meds, and it's run by Dr. Hale and his department down at the Infant Risk Center at Duke.
Love him.
And it's really great, and it's all evidence-based, and they update it. And also you can call their office. They get about 100 calls a day, but you can call their office and ask them questions.
And this is the Infant Risk Center.
Yeah, the Infant Risk Center. And you can look that up online, Infant Risk Center. And I think it's infantrisk.org, actually. And they will look it up for you. But if you have their app, and I have the more advanced provider app, but I also have the book that comes out every couple of years. So I just got my updated 2021 version. And
Medications in mother's milk. Love it.
yes, and they do all
Excellent.
the research. And then there's other resources as well that you can cross-check, and sometimes they have other information. Although the one that we used to look at is not being updated anymore, so we're really bummed. So I won't tell you what that one is because it's not updated anymore.
Mm.
And then sometimes like herbs and medication too. There's a lot of herbs that seem like, oh, they're herbs, they're all natural, but like they're actually not as safe for breastfeeding as you would think, or they could get in the way of medications you're taking.
Sure. I mean,
Right?
herbs are medicine. If we're taking them
Right.
as medicine, then we have
Yeah.
to give them that respect.
Yeah. So it's just super hard. It's really hard to find a medicine that you can't nurse on, even if a doctor tells you that you can't, but always double check that. And I will give you all
Always
the information I have
double
access
check.
to. And sometimes, even if we actually do find a medication that could be problematic, then you can figure out sort of a timing or a dosage issue and go, okay, well, could you give your baby 60% of your milk and be safer, and then maybe get donor milk or formula for the other 40%? Like, you don't have to quit entirely. Like, let's
Yeah.
look at the equations of the dosing and see what you can do. But
Or sometimes there's a safer alternative. I had a patient once who was
right,
on a
medication,
medication
right?
for hyperthyroidism.
Mm-hmm.
Forget what it was. But the medicine she was on, we were like, oh, this isn't actually safe for breastfeeding. It's one of the really few ones that isn't.
Mm-hmm.
But this other medication, let's call your endocrinologist and figure out if it could be a
Yeah,
safe alternative. And it was, and it worked out perfectly. So,
right.
you know, it's it's just something to question people that say it's not safe, because oftentimes they are not using any evidence to say that. The package insert of your drugs is
Mm,
not a good
nope.
resource for, is this safe for lactation? Check out the app. Jeanette, what was that app again?
Mommy meds.
Mommy Meds, or the Infant Risk Center, run by
Mm-hmm.
Dr. Hale, I would say, or Breast Milk and Conversation. Come to our group.
Yep.
All right,
Okay.
next question. How do I help my milk come in at the hospital? Um, what are some things that people can do to really help stimulate a good milk supply coming in at the hospital?
So many people are eligible and recommended to actually start doing hand expression of colostrum while they're still pregnant.
Ooh.
Yep. Around 37 weeks, although there's some studies that have used 34 and had success, and it's not a good idea to do at 37 or 34 weeks if you're at risk for preterm labor. But you could start at 38 weeks because now you're considered full term. Um,
Exactly.
where, you once a day, there's videos online. You can message me, I'll give you videos. Actually, babiesincommon.com, I put one video on there that some other wonderful organization made. It's just from YouTube. But um, to be able to, after you shower in the morning when you're nice and warm, like massage your breast gently and, a little bit vigorously, but don't hurt yourself, and see if you can squeeze some colostrum out, that early golden honey-like milk, and save it. And you could freeze it on a spoon in an airtight container. You could get some little tiny syringes and, put the lid on those and label them really well. And even if you don't get any colostrum out, say you're like, I've been doing this 3 weeks, I'm not getting anything, at least you've gotten used to doing the motions so that if you need to start hand expressing after your baby's born to try to get your baby to wake up or to try to entice them they have really good senses of smell. So even just a little colostrum on the nipple sometimes will entice them to wake up and go to nurse. So then at least you'll be like, oh, I know how to do this. I've been playing with my boobs for 3 weeks. So I think that's a good way. And then afterwards, the research is really interesting. It's shown that if people could nurse, put the baby to breast, and ideally the baby's suckling, or pump if the baby's not suckling well, 9 to 11 times on the first day of life, and even further after that. And if it could be more than 11 times, that's even better. So minimum 9 times in a 24-hour period, but even more than that would be better. 12 times would be awesome. To just put that baby to breast or put an effective pump on the breast. Lots of skin to skin, hours and hours and hours of skin to skin, where the baby's in just a diaper. I mean, not the first hour of life or two, right? They'll won't have a diaper on yet. Usually, but baby could have a diaper on, let's put it that way. And then just their torso between the breast or on the chest, really centralized. And so their torso is touching your torso, not their side, not their ribs, but really their nipples are between your nipples.
Mm-hmm.
Okay?
Belly to belly.
Belly to belly. And doing that for hours has literally, they've been studied around the world, different studies, that actually triggers your body to say, oh, the baby's here, let's make milk.
Mm-hmm.
And so it's really about frequent milk removal frequent. It's not all about just stimulation. They used to think it was stimulation, but it's really about suckling effectively from a pump or a baby with a good suckle is really,
Mhm.
or hand expressing, hand expressing, hand expressing, more hand expressing. If you're pumping, hand expressing after pumping is also really, really helpful. And that helps bring milk in a little sooner.
I, as a labor and delivery nurse, once I learned about hand expression and how important it was, because, and again, I'm not knocking epidurals. I had one. I think they can be an effective tool
Mm-hmm.
for labor. I feel like some people just want an
Mm-hmm.
epidural for pain relief in labor, and that's a perfectly legitimate
Mm-hmm.
choice. But the reality is that sometimes babies are super sleepy after
Mm-hmm.
epidurals or
Right,
really
right.
long labors or really long pushing or vacuum extractions or cesarean births, with all the meds that the mom or the birthing person gets. And, they're just on top of being super tired for that first 24 hours of what we call recovery sleep after birth. They are also kind of processing all of those meds that the mother got or the birthing person
Mm-hmm.
got. And once I learned about hand expression, again, on
Mm.
my own time and my own dime. So not all
Mm-hmm.
nurses know this.
Yep.
Heed Jeanette's advice, learn how to do it in pregnancy. I hand expressed at least, and this is a conservative estimate, 75% of the people that I took care of after labor.
Mm.
I worked in a hospital most recently that had a very high epidural rate. I would guesstimate at least 80%,
Mm-hmm.
if not higher. And I was helping that person either helping them hand express, or they were so exhausted from
Yeah.
labor that I was like, could I hand express your
Yeah.
breast for you? And I would just like milk them. And they were like, I
Yep.
don't care, and I'd
Yep.
like get it on a spoon and put it in the baby's mouth.
Mm-hmm.
And it is so amazing. It is so effective getting some of that colostrum in that baby in those first couple of hours.
Little
Um,
tiny amounts
oh,
matter.
it's so crazy how
Look
little,
at
I
it.
mean, a
You
baby
look at it as a
needs.
grown up and you're like, that can't be anything. I'll just throw that away. No, a drop is amazing.
In fact, I would get the 1 milliliter
Mm-hmm.
syringe, which
Teeny
is the
tiny.
tiniest syringe, and I would just suck up the drops
Mm-hmm.
off the nipple, and I would be like,
Yep.
"Oh my God, this is so precious," and like
Yep.
drip it into the baby's mouth because I wanted the parent to know.
The
I
parents
don't
look
want
at
to
you
bring
like you're
them
crazy. Like it's
right.
one drop. And you're like,
I
no,
don't want to bring
scientifically,
them
this is amazing.
a giant syringe or a big
No,
spoon and
right.
expect them to fill it. I'm going to
Yeah.
get the tiniest syringe
Yep.
and suck up every single morsel of this milk and be like, put it in that. Sometimes I wouldn't even get a drop. I would just wipe my finger
Yep.
on the nipple and
Yep.
just smear it in the baby's
Yep.
cheeks. And I'd
Yep.
be like,
Yep.
just that can
Absolutely.
make a big difference. So, definitely skin to skin, rooming in. And,
Yeah. Keep
if
that
the other
baby
thing
with you and on you.
I would say is if you are separated from your baby for
Mm-hmm.
any reason, let's say they need a NICU stay or they have to go to the nursery for care. They used to say, within 6 hours of birth,
Mm-hmm.
try to get a pump in there. Now they're saying within 2 hours.
Mm-hmm.
So you might have to be a broken record. Can I get a pump?
I
Can I
know.
get a
I
pump?
still
Can I
hear
get a
that. Oh,
pump?
did they get you pumping? They're like, no. And
No,
even people who said I was asking for a pump and they didn't bring it to me till the next day. I'm like,
no, it's a
that's
big problem.
inexcusable.
As
Yeah.
a nurse, I often was the one being like, we got to get you pumping, got to get you pumping. And I would get report from people. These people would be 6, 12, 18 hours
Mm-hmm.
post delivery,
Yep.
separated from their baby, had not started pumping
Right.
yet. And it's not that the nurses are bad. A lot of times they're saying things like, well, she's so exhausted, or they're
Mm.
overwhelmed. They're worried about their baby. I didn't want to add another thing to their plate. And I understand that. But I also understand that for people that desire to give their own milk to their baby or to have a nursing relationship, and they are separated, sometimes helping them pump and hand delivering that colostrum to the baby right in the NICU can be something that really helps them through that tough time of being separated, right?
Mm-hmm.
I would say to them, I am going to hand deliver this milk to your baby. I'm going to walk it all the way to the nursery, and I'm going to make sure I'm going to hand it to that nurse. And as soon as that baby can start eating, your milk is going to be the first thing that they get, right? So as exhausted as that person is, you might have to be like, I need a pump. I need a pump. Get me a
Mm-hmm.
pump. Get me a pump.
Yeah. I had
you
somebody tell
know?
me the other day that she brought her pump to the hospital. And I mean, you could do that. I don't know that you really need to do that, but ideally you would use a multi-user pump that the
Yeah, the
hospitals
hospital
have.
grade pump. Sure, I
That is
agree.
really, really the best type of pump. It's usually a $2,000 machine and it's just made differently than the pumps you'll get for having at home. So ask for those. Ask for those. They've got a team of them in a closet somewhere.
Absolutely.
Yep.
And I mean, I've been doing this for 14 years. The pumps that we had back when I started were really complicated to set up. And I understood in a way, again,
Mm-hmm.
this is with a caveat, but I understood being like, oh, people being like, oh, I'm overwhelmed just setting it up for them. I've got so much to do. The pumps now,
Mm-hmm.
like the hospital grade pumps, are super easy. It's like
Mm-hmm.
click, click, and you're already set up. I
Mm-hmm.
mean, it is super easy. So you got to sometimes be that squeaky, wheel, or
Mm-hmm.
partners. You got to be that
Yes.
squeaky wheel.
Or
If
your partner can do hand expression too.
That's true. Hey, I have
Mm-hmm.
milked a lot of people.
And I always say you were born with two hand pumps already.
Yeah, right.
So if you and your partner or somebody in that room with you is willing to use their hands to do multiple times of hand expression, then you may not actually need an electric pump for that.
Or if that partner, even if they don't know how to do hand expression, if they're just massaging your
Mhm.
breast, right?
That gets
I
it
mean,
ready for
that's,
pumping.
yeah, is absolutely.
Yeah.
Okay, here's another good question because
Yep.
this comes up a lot.
Mm.
My last baby had to receive supplementation of formula at the hospital. I do not want to give formula unless it's absolutely necessary. What if my baby needs supplementation this time? What options do I have?
So first is your own pump milk. You could also bring colostrum with you if you're able to collect that. Make sure it's got your name all over it, stays frozen. Give it to the nurse when you walk in and say, put this in the lactation freezer. That's what nurses tell me is you're supposed to say the
Yep,
lactation
put it
freezer,
in the
quote unquote,
lactation freezer. Yep.
with your name all over it. Make sure it doesn't defrost. And so your prenatally expressed colostrum is one. Your pumped milk or colostrum after your baby was born is another. And then if you don't have access to those two, then donor milk, which you can also get like donor milk from the local milk bank, local meaning regional, and you can ask to purchase that milk ahead of time to either have delivered with your name on it to the hospital, or you go pick it up or get it delivered to your house and you bring it with you. Depending on the hospital, they may have different rules about that, so you want to double check with that. But some hospitals have donor milk and you just have to ask for it, and a lot of hospitals don't have donor milk handy. So you could use donor milk, and then otherwise it's formula. And when it comes to formula, if you don't have access to all those other things and you need to use formula, what I now think is a good idea for you to do is to ask for elemental formula. So it's an amino acid based formula. It's not the typical cow's milk protein as the number one ingredient.
Sure.
It's broken down a lot more than that. And the reason I say that is because that has been shown in some recent studies to be, we think, preventing some babies from having an allergy later on to cow's milk protein.
Oh, interesting.
And so if you could just have your baby be supplemented with elemental formula, that's going to lower their risk of having a dairy allergy,
And
which
so
is
I
pretty
know
cool.
like we're not, you know, talking about brand names and stuff like that, but
Mm-hmm.
this is something that I see a lot on baby
Mm.
groups and stuff. So this is when you say elemental formula, this is things
Mm-hmm.
like elementum,
Mm-hmm.
right? Yeah.
Mm-hmm.
Okay.
Smells horrible.
Yeah, it does
And
smell
if you had to purchase it, it's very expensive. But
very
the
expensive.
hospital will have that there, and they would be able to give that to you.
And we actually did a whole episode on this, actually, episode 18. It was called Milk Banks, plenty of
Mm-hmm.
milk for families and hospitals.
Mm-hmm.
And we dove into, we talked to Cynthia Cohen, the one of the director of client relations for the Mother's Milk Bank Northeast,
Mm-hmm.
about the donor milk process, how people can obtain donor milk, that some hospitals, which hospitals, some hospitals can allow it to all babies. Some hospitals choose to only give it to, high risk babies. And again, you are a consumer of healthcare. So that
Mm-hmm.
could be something that you make a decision about when choosing the place that you want to give birth, if you're choosing a hospital.
Yep, absolutely.
The other thing I would say as a nurse is, ask questions. Is this really necessary? Because a
Mm-hmm.
lot of times supplementation is recommended on what I call the slippery slope
Mm-hmm.
advice, right? So let's say your baby has jaundice. Let's say your baby is losing weight.
Mm-hmm.
Let's say your baby is et cetera, right? Has low blood sugars.
Mm-hmm.
And you're told you need to supplement. Well, any good childbirth class, including mine and Jeanette's, would
Mm-hmm.
talk about, what we say the brain questions, right? What are the benefits? What are the risks? What are the alternatives? And so sometimes people say, well, let's say jaundice, right? In the world of nursing, we talk about, okay, so when they check your bilirubin level, which is the thing that causes the yellowing of the skin and jaundice in a baby, you get a number. And then the lingo is what's lightable? What's the light up number,
Mhm.
right? Meaning what number that for this baby's age and weight and gestational age and age in days and hours and whatnot, what level of bilirubin do they need to be at to require phototherapy, which is the way that they treat jaundice in the hospitals. They put these babies under these little blue lights. Sometimes, let's say the light up level is 17, I'm just throwing it out there, and your baby's 15, but 15 is close to 16 and 16 is close to 17. And the pediatrician just wants to be proactive and,
Mhm.
and really what you could do, the alternative to, supplementing that baby with formula for their jaundice or their weight or their blood sugars is to just wait a
Mhm.
little bit longer, one more
And
feeding,
continue to
6
feed your baby.
hours,
Yeah.
12 hours. Yeah, get a
Mhm.
lactation consult in,
Mhm.
right? Let's say, there's a big difference. This 10% weight loss is a big number thrown around the hospital, but there's a big difference in all of the lactation literature between a baby that's getting close to 10% weight loss and the birthing person's milk supply is coming in. They have an
Mhm.
effective latch. They're peeing and pooping appropriately. Yeah, they might be maybe losing more weight than, other babies,
Mhm.
but all signs point to this baby's going to start gaining soon. That's different than a baby that is preterm or not latching well, painful latch, tongue
Mhm.
tie, not peeing and pooping, right? And the mother's or person's milk supply has not started to transition
Right.
and they are losing a lot of weight. That's a totally different picture. So
Right.
your number one thing before you consider supplementing for things like weight loss or blood sugars or
Yeah.
jaundice is, can I see the IBCLC before I make this decision? I think that would be a great
Yeah, because they're going to try to help
recommendation.
advocate for you and figure out other solutions.
Totally.
Um, there's also that when babies are born to people who have had a long line of IVs,
Yes.
they're going to be inflated in weight. And so their weight loss may be very quick and look more severe than it really was, right? So
Yep.
it's always looking at what happened with the birth and maybe some of this extra weight loss that we're looking at as, ooh, it's looking like a scary number of weight loss. Well, maybe it was because there was all that IV fluid. But if they had an unmedicated birth with no IV fluid, then a lot of weight loss can be very concerning,
Absolutely.
right?
Yep.
So, and I think what I see sometimes is people say, well, I had milk, but they said the jaundice would go down faster with formula. So they
Mm.
insisted I use formula and
I
just
just
store
want to
the milk.
cry when that happens.
And there is no evidence for that. And
Yeah.
that is mind bending. There's no evidence for that. So if you have milk or there's donor milk available, then you do not need to use formula. And you can argue about that. Like, I always ask them, like, where's your evidence for that? And they'll
Sure.
show you one study where the numbers went down. Like, well, okay, fine, but that's artificial. Formula is artificial. So if jaundice numbers go down faster with formula, that's still fake. Like the real thing would be with breast milk. And there's long term risks of using formula in a situation where the baby could have had human milk. And
Sure.
that doesn't sound nice. And I know people want to think that formula is the same as breast milk, but it's just not. I'm glad there's formula. I know we need it to exist. I wish it was better than it is. And some formulas are better than other formulas. But formula is really meant to be a replacement for milk.
Right. Yeah. So it's not that there's any moral judgment on formula, but
Right. It's just a
formula makes the babies,
scientific biological
let's say,
differences.
jaundice level go down faster. Is that necessary? If it's
Right.
going down with breast milk, does it have to go down faster?
Well, they also make it sound really
Yeah.
scary. Like it takes a lot for a baby to reach a very scary jaundice number. And fortunately, very scary meaning that it could have detrimental effects to their
Sure.
brain. But it's also really interesting and good that what I'm seeing now over the last 10 years at least is that hospitals are being really vigilant about checking, and so are care providers, your pediatricians after you get home. They're really checking jaundice levels closely. So it's really rare that a baby's going to get to a level where they might say, and maybe it would be warranted there to go, I'm sorry, we got to give this kid formula because the levels are so high.
Sure.
I mean, that could happen, sure, but it's not as common.
Right. Just ask questions. Are there any
Yeah.
alternatives? Can we retest in 6 hours? Can we retest in
Yeah.
12? Can we retest the next feed? Can I have a lactation consult?
Yeah.
Absolutely.
Yeah.
All right. Here's a really good question because this is like the ubiquitous baby shower gift. Okay.
Mm.
I was gifted a nursing pillow, but it's very low and hurting my back when I'm feeding. Is there a certain nursing pillow that helps with mom's posture? What do you think, Jeanette?
I mean, there are a couple breastfeeding pillows that if you really need one, they're probably better, but really it depends on how tall your torso is, how long your breasts are,
True.
what chair you're sitting in, how squishy is the cushion that you're on, like what position do you want to be nursing in? Like there's so many factors that I actually feel like if somebody has one of the most common nursing pillows, which I won't name so that the company doesn't come after me, but like there's a really common like sort of I don't even know C-shaped pillow,
Yes.
and there's a few brands of them, but they're really not that great for nursing. And
They
I
like
mean, they
tip
might,
the baby the wrong way
yeah, and they
sometimes.
roll them into you, or like they're really meant for a size one, so they like pop out when you put it around your waist. Like most people are not a size one, so they
Yeah.
pop out, and the baby sinks into the center right on your lap anyway. So I'm not a huge fan of those for most things. But I think figuring out what rolled up blanket would work to support your arm that's holding the baby, or to support under your elbow, or to support the side of the baby, because typically the baby should be nursing on their side, unless they're on top of you when you're laying back. And then you don't need a pillow because the baby's on top of you,
Sure.
right? In that
Back
laid
nursing.
back position,
Yep.
or in the koala position, if you're sitting and the baby's literally sitting on your thigh, looking like sitting straight up, and looking up at you
Yes.
and nursing.
Oh, I
You
love
know,
that. I've never heard it
that's
as koala position.
yeah,
That's
it's the
great. It's
koala
that's totally
position.
what it is.
Yeah, yeah, yeah. And sometimes they're leaning the other way, so I call that leaning koala if they're like sitting on your left thigh but feeding off of your right side, you know.
That's so
But
true.
sometimes, depending on the length of the baby's torso, you might need a little rolled up blanket under their butt, right, to lift them up. Or I think rolled up blankets, especially those thin muslin ones, those big, big, thin muslin ones. I don't care that they're rolled up nicely, like just squish them everywhere you need them. Or a small pillow, or your bed pillow that's small and squishy.
Yeah, I
Like
didn't actually use
finding
a
those
nursing
pillows.
pillow for any of my kids. I used throw pillows because they were kind
Yeah.
of firm and
Yes.
small.
Yes.
And so I just tucked them
Yes.
around me because I
Yes.
found the same thing. I'm a pretty thin person, and those
Mm-hmm.
nursing pillows did not fit me
And you're
properly.
tall. Yeah.
Yeah.
Yeah. Yeah, I think we're born with a pillow. It's called our belly right after you're giving birth. You still
That's true.
have your belly, and then we have arms and thighs, we have enough. But chairs are the fake thing involved here, right?
Yeah, right,
Typically, if you just gave birth, wouldn't it be great if you were laying down
right.
or at least semi-reclined? Like put your baby on top of you. And I know that for some people they need to sit up to latch the baby and get it just right and then they can recline. And so
Hmm.
I try to make sure everybody I'm working with like figures that position out, or side lying where both people, the baby and the parent, are lying sideways. That can be really helpful, but it depends on the cushions too. Yeah, so
So if
I don't think.
breastfeeding or chest feeding or nursing isn't working with a pillow, try not
Mm-hmm.
using it, like
Mm-hmm.
the breastfeeding pillow, quote
Mm-hmm.
unquote. That might be the problem. Maybe you can
Yep.
get a better latch with a rolled up blanket
Yep.
or just a throw pillow or
Yep.
something.
The other one thing I'll say about that too, is that a lot of people end up because the baby is higher, right? And
Yes.
their breast is lower, they lift their breast and then they like angle it towards the center of their chest because for some reason in whatever artworks we've been seeing, which is really crazy because there's some really great normal breastfeeding art in ancient history.
Yes.
But for whatever reason, we forget about that and we look at, oh, the baby has to be centered on me. So my nipple needs to be directly in the front and my left and pointed forward. And so we lift the breast and we pull it over. And meanwhile, your breast wants to sink down and curve to the left. So, like,
Right.
put your baby there. And so if you've got a pillow that's lifting your baby too high, then you have to hold your breast the entire feeding. Because if you don't, it falls out of your baby's mouth. And I've had
Right.
people say to me, like, the baby just can't stay on. They can't keep latching. And I'm like, did you see what you just did there? You just let go of your breast, and the breast is so heavy that it fell out of their mouth. So let's figure out where your breast falls and put the baby there.
Yeah,
Yeah.
totally.
Yeah.
All
What's
right.
next?
You're like, in my opinion, the tongue tie guru. So this is a good one for
There
you.
are many
Another
who
one of
know
our
more than me. I learn from them.
I know. But you're my hero. You're my tongue tie hero. So this is a very common question. In fact, the last 3 babies that I saw born, this is not an exaggeration, had obvious,
Mm.
almost to the tip or to the tip tongue ties. Like,
Mm-hmm.
wow. Like the fact that some people don't believe this exists is
Mm-hmm.
crazy to me. Okay, so one of our listeners said, what do I do in the hospital if I think my baby is tongue or lip tied?
Well, many hospitals are not allowing their lactation consultants to talk about tongue tie.
This is a fact. Fact.
Yep.
There's a
Fact
gag
checking is
order.
correct. Gag orders. You will be reprimanded or fired if you talk about tongue tie.
Yes. In fact, I was told once as a
Mm.
nurse that that is a diagnosis, and it is. This is all in scare quotes
Even if
for
you
those that are
said that
listening.
might be a tongue tie,
Even if I
you
said there's
weren't
a
diagnosing it.
restriction of the
Right.
tongue's movement, I was told,
Mhm.
Melissa, that is considered a diagnosis, and it is not within your scope of nursing practice to make that. And otherwise, you're just going to make people nervous. Was the email that I
But if their
received.
baby's arm was not moving, what could you say then?
Yeah, I could say the baby's arm isn't moving. Like, can we get an
Is that a
X-ray on this?
diagnosis? Is that a diagnosis?
No,
You're
it's
going to make the parents
ridiculous.
worried?
It's
Right?
ridiculous.
Any other potty part, you would never have anybody talking like this.
Never.
Never. But the tongue, which is actually a really important body part,
Super important for
is
feeding.
political. It's politicized right now.
Yeah. And for bottle feeding, breastfeeding,
Either one.
chest feeding, whatever.
Most of the
important.
bottle refusal consults I do when babies won't take a bottle is because there's a tongue tie.
Ooh, yeah.
Yep. Not all, but most.
Wow.
Yeah.
So what should you do if you think your baby might be tongue-tied or you're
Well,
worried
I
about
think
that?
you can say explicitly to the lactation consultants and the nurses and the pediatricians, like, well, I think that's a tongue tie. And they might say, yes, I think it is too. And at least you're getting like a few people's opinions, right? And it's really helpful when I see somebody who says, well, I had one the other day. The neonatologist said that that was a tongue tie, but it shouldn't get in the way. And the lactation consultant said, well, it might be a slight tongue tie, but the pediatrician said it wasn't a tongue tie, and like, she's like, I'm so confused. And I'm like, yes, I can see how you'd be very confused, but at least you're hearing what other people are saying about it.
Mm-hmm.
Sometimes you're going to hit on the right person who's going to give you feedback and go, I think you're right. It doesn't seem like your baby's tongue is moving appropriately. That might be a problem. So you should see a lactation consultant when you get out of the hospital.
Ding,
And again,
ding.
the other thing about the conversation we had about the CLC, the certified lactation counselor like you are, is that some CLCs are calling themselves lactation consultants.
Mm.
And as a parent, you need to be careful. And I'm not saying they don't know anything, right? Like, of course,
Right.
I was a breastfeeding counselor for years before I did what I do now. But we all have to learn somewhere. But you don't get tongue-tie training as an IBCLC. It's not, you can become an IBCLC without tongue-tie training. It is not part of our basic training. So it's really figuring out who are the IBCLCs who have extensive training that they paid for themselves and took the time and usually flew somewhere else. We have not flown in so long, right? That
I
just
know.
Said flied.
Like out of our vocabulary.
I don't know how airplane talk is anymore. But getting extra training in tongue tie. And there are resources on the internet, but you can ask family members. And you can also just look at the list of lactation consultants, IBCLCs that you have for your area and call around or look at their websites. Do they mention tongue tie? Is that something that you can ask them? Like, do you have experience in training in this? And see. I don't think that everybody's going to get their answers resolved in a hospital. There are some hospitals where they will say, oh, yep, that looks like a tongue tie. We have a doctor here that can fix that can clip that for you. And I think most of the time, I would say let them have a go at it. There's one hospital where I'm not a big fan of that, but, have a go at it, like see what they can do. And if that fixes all the problems, then great. However, me and my colleagues see so many babies who someone had clipped, quote unquote, the tongue in the hospital, released the frenulum under the tongue, that membrane, had clipped it in the hospital, and the parents went home thinking it was fixed for weeks.
Right.
Oh, I'm having all these problems, but it's not a tongue tie because we had that fixed in the hospital. And then we see them, me and my other colleagues who are well trained in this, and we're like, yeah, they barely touched the frenulum. There is still a lot of tight frenulum still there. They did not do a good job and release it well. So the second you think you're still having issues, do not for a second think that they fixed it in the hospital. Maybe you should have someone like me look at it. And really
Totally. If you're still having problems, if it's still hurting, if the baby isn't gaining, don't take, I guess, like, not no for an answer, but like, don't take, you've already done it for an answer. Like, I mean, just keep asking questions because you are your baby's best advocate.
Yep.
Get a
and
second
many
opinion.
Pediatricians don't know about this, or they're deniers, like climate deniers, they're tongue-tie deniers.
Exactly.
You know?
They are, though.
And
They
you and I
are.
have friends who are pediatricians, and they say the same thing. Like, we didn't learn about this, you know?
Right.
Like,
Yes.
yeah, it's a real thing. And I actually did a consult yesterday, and there was no tongue tie, and it was awesome. There were no problems. She had plenty of milk and no tongue tie, and a great suck on that baby. She just needed some help with positioning.
That's
I was
awesome.
like, I love this. This is great. Like, it does
You
exist.
deserve
I'm
that
not.
every once in a while,
I
Jeanette.
know. Like, I'm like, there's this rumor in the medical community for some people where they think that all IBCLCs want to find tongue ties. Like, we're going to diagnose every baby with a tongue tie. And that is just not true. Like, I am trying not to find one, but darn it, I'm going to look really well. And when
Of
I don't
course.
find one, I look 2 and 3 times. I'm like, I got my fingers back in the baby's mouth. I'm like, let me just double check and triple check. Like, I want to be really sure, like, anything that might come up, you know? And I'm like, your baby is totally normal anatomy, has a great suckle. This is all you needed help with. Great. That's
Mm-hmm.
awesome. One less thing to worry about. But I also actually in the last few days saw a 6-month-old who has an anterior tie stuck like the tip of the tongue. Can't like as soon as the baby opens the mouth, you can see the heart-shaped tongue.
Oh
And
my
there's this
gosh, wow.
huge big groove in the center of the tongue. 6 months old, and every person that parent has come in contact with is like, nope, that's not a tongue tie. The baby's fine.
Wow.
And I'm like, oh, and she's like, no, I know this baby's not fine. Something's not right. So that's why she finally sought out some help. But
Good for
it was
her. It's so
ridiculous.
hard. I
Yeah.
mean, you're exhausted, you're recovering from birth and sleepless nights and trying to manufacture the baby's nutrition.
Mm.
And people are being like,
Or
"Nah,
even
it's
if you're
not-"
bottle feeding, like I have done several, including this baby, this 6-month-old was 100% formula fed.
Wow.
And
Okay,
yeah,
interesting.
and so has never nursed this baby. Like she's like, we're doing formula. I can't tell you the whole story, but anyway, they're doing formula, and I've seen this before where I've done consults with people who are just formula feeding their baby for whatever reason, and they're like the baby like leaks all the time with the bottle, or they take forever to drink from the bottle, or they'll only use this one type of bottle, or they spit out every pacifier I give them except this one weirdly shaped one, or they can't hold any pacifiers. Like it's there's so many different ways that can manifest. Even babies with colic, right? Like
Sure.
colic is the quote unquote unexplained reasons for crying. Oftentimes it's a feeding problem.
Yeah, we actually interviewed our podcast episode number 15. Amanda Jesse is a visiting nurse, a VNA nurse, and she herself had a formula feeding, bottle feeding baby that was not
Mm-hmm.
gaining weight. And
Mm-hmm.
she told her story about how she ended up seeing an IBCLC
Mm-hmm.
for her formula fed bottle feeding baby who needed a tongue tie release. And for
Mm-hmm.
months, the pediatrician just said that the baby had
Yep.
a behavioral issue.
No.
I mean, a 3-month-old baby does
No.
not have a behavioral
Nope.
issue with refusing the bottle. Like,
Right.
wait till the teenage years for that. I mean,
Right.
come on.
Right. Right. Yeah.
Oh my
It's just it's not
gosh.
well known, and it depends on who you talk to, but you want to seek out the right answers.
All right. Well, that was an awesome show, Jeanette. Those are so many great questions from the Babies in Common community. I think we should leave them with a cliffhanger. What do you think?
Mm-hmm.
All right. So
Yeah.
stay tuned for part 2 of your questions answered.
I know we had
for,
so many we couldn't finish them all today.
right, breastfeeding, bottle feeding, and feeding, etc. So we hope you'll visit babiesincommon.com/show to view all of our previous episodes and see what we have coming up as well.
Our show is available as a video recording too, and if you like the show, we always like reviews. We hope you will also look at our Facebook group and our Facebook page and the Boobies in Common Facebook group and see our options for virtual groups as well as prenatal classes and consultations. Because remember, as always, it's a community, Babies in Common. We're a community for you because we all have babies in common.
Have a great
All right.
day, everybody.
Stay tuned for our next one.